Boa noite, senhores telespectadores, e é com todo o prazer que nós regressamos esta noite para trazer este médico muitíssimo especial na nossa comunidade, a um grande cirurgião, a um grande amigo da comunidade portuguesa e, acima de tudo, a um grande médico, um grande ser humano. Doctor, you know, welcome back. I know we are not here for a while, but we all miss you.
Thank you for having me.
Yeah, you know, you have a lot of patients already waiting to call you.
I'm available and we're ready to go.
You were a blessing to this community. God is good to us because you've done a lot of beautiful things to our people.
Well, thank you very much, and at the same time, I'm very humbled. So I'm looking forward to keep working and doing the best job I can.
O Soutor é muito amigo dessa comunidade, mas tem um particular muito especial. É um grande médico, mas é um grande ser humano. Nós não podemos ser bons numa profissão se não formos amigos dos nossos amigos e amigos do povo. Senhores telespectadores, é um prazer estar convosco. Esse é o nosso programa, meu, doutor e de vocês. Chamem-nos, aproveitem este dia do doutor aqui e a linha está aberta. O número de telefone é 973-264-1462. Portanto, chamem-nos quando quiserem. Chamem o doutor, que ele é aquele médico. Eu estou aqui para lhe fazer companhia. Doutor, I got a lot of calls from people. Who were you? Where did you go? Why didn't you come? I said, he's too busy. Besides, we had construction here. This is beautiful, isn't it, Doctor?
I am very impressed at what I'm seeing here.
It's because you became part of the family.
You know what? I'm very welcome, and at the same time, I'll keep visiting. I promise.
Thank you, Doctor. Thank you. Portanto, senhores telespectadores, chamem-nos que nós estamos aqui à vossa espera. O Soutor gosta muito de ouvir vocês, adora ajudar vocês e eu sinto muito orgulhosa de estar aqui connosco. So, how's everything been with you and your family?
We're doing very well. I have 2 children. One daughter just got married recently, and my other daughter is also doing very well. So we're all healthy, we're safe, and very happy that the past has ended and we're going on with our lives.
I know you were so worried about this. You were one of the doctors who were extremely worried about it.
Well, you know, we're still being affected by this, and the population around us has to know that. So please continue to get your vaccinations, your boosters, maintain safety. It is so important now that we get back to our regular lives so that we can continue to grow and get better. And at the same time, do the preventative things that are so necessary that we've lost during COVID, because that also contributes to unfortunate health issues that are really necessary. So my call is to everyone right now in our communities is to get back and do the things that you needed to do to get better.
Yeah.
And be preventative.
Nós depois voltamos. Boa noite, faça favor.
Hello. How you doing? It's Manny.
I'm Manny. Oh my God.
I just found out that you got my favorite doctor on the air.
Oh, your favorite doctor. Wow. Yeah, you have your favorite doctor.
Yes. I'd like to say that Dr. Gilder is one of the best. He's got God's hands.
Oh, you're going to make me cry. You have God, and I believe you. I believe you.
Yeah, he came highly recommended by a certain angel, and it pretty much saved my life.
He saved your life. He is a good doctor. I'm going to cry because I know the doctor. Listen, I only bring you to my people, to everybody, what's good for me. Okay, and
and everybody should be aware of it. You know, I took it for granted that we should get checked. It's an easy procedure and should get checked for colon. So.
Well, at the same time, I'm happy to hear you're doing well.
I'm keeping a positive attitude, Doc.
All right, keep going.
Yes. I mean, just within my operation, by 12 o'clock at noontime, from a Friday to a Sunday, I was home for lunch on Sunday with no pain whatsoever. And something that could have been avoided if I, had listened to my primary physician and getting my colonoscopy as I was supposed to.
Well, at the same time, I wouldn't look in the past, and at the same time look at your future. And with just a little bit of time and effort of what took place, you have a wonderful future ahead of you to be with your family and your children. And we got you back to the way you really want to be. And at the same time, you're going to thrive and you're going to stay well.
Yeah, I appreciate that very much. And, so your audience knows that going to your office is like, I don't know, being in my living room. Everybody was so nice and pleasant, and even yourself, you took a lot of time to explain to myself and my wife what the procedure was and if we had any questions or whatever it is. So I'd just like to say that so everybody knows that, you are a special doctor.
Well, we'll also understand that you had a surgical technique that allowed you to be in the hospital within 48 hours, and that's robotic surgery that has tremendous benefits and limits pain. It allows you to get back to the way you want to be, and that everyone in this community has that availability, and that is something that we offer to all patients.
Yes, very true, very true. So I really appreciate it, and I'm recommending people that in the age of 30 go get checked, because it's so important nowadays.
All right, Manny, stay well.
There you got it, Doc.
Excuse me, doctor, you gained a whole family with Manny.
That's okay.
Because the family, they really, they can't believe how good you are and the way Manny felt and all this. Now everybody's going to see Dr. Gelder.
That's it.
Yeah.
Good night.
Well, there are plenty of other wonderful physicians also that are part of our community to take care of you and your family. So I look forward to just being able to take care of you all and at the same time getting you to the right people.
Appreciate that very much.
Thank you, Manny. Bye-bye, honey. Such a good guy. Such a great family. He has 2 boys who they are. That's a pleasure to be part of that family. It is.
Happy we could help.
Yeah. Senhores telespectadores, temos linha aberta sobre o vosso programa. Está muita gente, there's a lot of people complaining about depression.
Mm-hmm.
And someone told me that a lot of people came out with this problem, which is not a pleasant one, due this epidemic situation.
Well, I think that's true. I think COVID has changed a lot of our eating habits, more alcohol also. A lot of us in a situation where we were dealt with such terrible situations that, we did things that we didn't necessarily need to do, and by eating more, not exercising, being locked up in apartments and homes, it wasn't beneficial to us, and depression also happens.
I'm gonna get back to you on this. Nós temos, we have another call. Boa noite.
Boa noite.
Faça favor, fale, diga-nos.
Eu preciso falar com o médico, mas em inglês.
Sim, senhora. Aqui fala-se português, fala-se inglês, e se a senhora sabe falar inglês, é muito mais simpático para a senhora e para ele. Faça favor, minha senhora. It's a lady who only speaks English.
Mm-hmm.
Go ahead.
I am a cancer patient, stage 4, and I have lymphedema really bad, and my hand is paralyzed. And they tell me that I may have scar tissue under the arm, and that's why my hand is paralyzed. I want to hear from the doctor.
Well, I'm assuming also that you may have also had radiation at the same time. Was that part of it?
Yes, I had radiation, and I'm on chemotherapy right now.
I understand. Have they been able to enroll you in any kind of physical therapy or occupational therapy?
Yes, I go for for lymphedema therapy once a week, and my hand is paralyzed, and my right hand, and that's the side that I have the cancer.
At the same time, they're using agents that are trying to help you and keep the cancer under control. Unfortunately, that and some of the agents that they use may affect your ability to feel and the nerve function. That does happen. They call that neurotoxicity. And that is unfortunate, but at the same time, they need to use certain medications to keep you going and at the same time try to up your quality. So I understand that, but I would continue to do whatever kind of physical therapy or occupational therapy that you're engaged in to try and maximize your function.
Okay. Okay, doctor. Thank you so much.
Wish you luck. Good luck.
Okay, bye-bye.
Thank you for calling. Senhores telespectadores, podem continuar a chamar, que esta noite este programa é nosso e vosso. But doctor, I see a lot of people, friends and non-friends, I talk to a lot of people. That's a horrible thing. Depression is a horrible thing.
Sure, absolutely.
Because not everybody, people think depression can be treated only with drugs. Not really. You need your attitude to fight.
I think you need everything to fight it.
You need everything to fight it. You need people who encourage you. You need to be optimistic. You need to do things that really make you happy and not stay home closing and thinking that you're feeling the way you're feeling. That's a horrible thing, doctor.
I think in many ways, something like depression is a lot harder to fix than certain problems, certain physical issues that at the same time, yeah, we have medications, antibiotics, but depression is much more complicated.
Very, very, very complicated. So, I don't know, doctor, I don't even know what to recommend because some people, they're so drugged up that they can't, function sometimes, depends where they go.
Right, but if the drugs can bring you back into a situation where you can function and then all of a
That's a
sudden
great thing.
pick yourself up and then, okay, I have this and at the same time I'm going to be dealing with it. But understand that those medicines are still very vital to help the people.
We send to psychiatrists.
Psychiatrists are beneficial, neurologists are also can be very helpful. There's an art to this. It's not just a science.
Yeah.
And what's good for one person may not be exactly the same for another.
Yeah.
There's different medicines that are geared for younger people, medicines that are geared for older people, and at the same time, it's definitely art. It's not cookbook at all.
It's not cookbook. And you have to work hard at, you just have to do things yourself. Buy a good book. They have wonderful things that you can
Sure.
read.
Well, there was a very famous American patriot named Benjamin Franklin, and he wrote about moderation, and moderation with eating, with exercise, with drinking, with your life. And he wrote specific essays on this.
Oh, wow.
And he was a genius because what he said made so much sense, and at the same time, if you maintain moderation, you will succeed.
I agree.
And he wrote about this in the 1700s.
Wow.
So that was pretty cool.
Thanks you brought that back.
Okay.
Because I get very proud and very happy when we bring people who did wonders and people forgot about them.
Oh yeah, I think people who did things in the past should be recognized.
Yeah.
Maybe that's something the young people shouldn't forget either.
Do not forget, and they're forgetting it because that's the cell phone, that's the internet, that's everything. The books are sleeping.
Well, I'm learning that I'm becoming a rapidly old person also. So although I've hit just 60 years, I'm now an old man in their minds. But that's all right. I have a lot to go.
Well, doctor, if you're an old man, I'm gone.
Oh, okay.
Good evening. Boa noite, faça favor. Sim? O senhor está no ar. Pode falar, se faz favor. Perdemos a chamada? Boa noite. A pessoa desligou? Oh, okay. Well, doctor, if you feel that old, I feel like I'm gone already. I'm calling from up there.
No, that's not true.
Listen, doctor, I think it's a wonderful thing when you are a good doctor, a good person, and people go and remember. Even our family, even our kitchen table, you learn so much. And people, it's a shame that this generation, they're not going back. See how you're showing the picture of your father-in-law? I think it's a wonderful thing. It's good for you, and that's going to be good for your children and for your grandchildren. Because it was so important to the family that you're still going back to that.
Well, I mean, that's all about our history.
That's all
and our
about,
roots.
that's right. But some people forget to do the ones who die. They go put flowers in the cemetery. Forget about the flowers. Flowers you give him all day life.
Okay.
You talk about the good things that they did, and they really give, I grew up with a lot of old folks. Yeah. Boa noite, faça favor. Hello? Há qualquer coisa errada é comigo ou é com o telespectador? Boa noite. Eu? Ai, coitada, está a desligar sem querer. Boa noite. Não há.
Well, I wanted to say something to the people in the community here, and I just learned recently that healthcare is becoming part of the election in this area. And I want the community in this area to know that the Robert Wood Johnson Barnabas Medical System is here to help you, and to certainly participate in your services and your care, and offer all the things that you all need as a community that is available. The specialists, the primary care, pediatricians, obstetrical care, all of that is available to this community.
Let's bring me a doctor. Let's work something to bring these doctors here.
Well, it has to happen.
Has to happen because this is a wonderful community. And our people are wonderful, because I've been working with them for so many years, and I tell you, it's a joy to see them. It's a joy to treat them because they become loyal to you and remembering you for the rest of your life.
Well, Ironbound is vital to Newark.
Absolutely.
And because it's vital to Newark, and there's a young population, a middle-aged and an older age population here, our medical community, our system has to recognize people here. And
we have to talk about it, you and I,
well,
and work out something. I'm ready for that.
But the public should know about this, and so should the councilmen and the council people that are running for this position. They do need to recognize that there is tremendous benefit in having a powerful healthcare system
Absolutely.
available.
We're going to work at that. Boa noite, faça favor. Boa noite.
Boa noite, Dona Isabela.
Diga-me, linda.
Eu queria fazer uma pergunta ao doutor.
Faça, senhora, ele está aqui para
I'll
você.
do the best I can.
Eu sou a Laura. Eu sou a Laura Rodrigues.
Sim, diga, faz favor, dona Laura.
Ok, vou falar para o doutor.
Fala, é português ou é inglês?
Inglês.
Ok, vá, minha menina. O programa
for
é seu.
it.
Hi, doctor. How are you?
Hello, how are you?
I was diagnosed with purpura,
Okay.
and I got a rash in all my body, and I went to see to dermatologist.
Right, a
And I don't
hematologist.
see nobody helping me.
Well, the hematologists are really the experts when it comes to this condition. Not your primary physician, but hematologists specifically are the ones who are experts in allowing, and as far as making the diagnosis and at the same time treating you. As a surgeon, this is not my forte, and I'd be the first one to say that really it is the hematologist, the oncologist together, the hematologist specifically, that's what this condition is treated by.
Can you get a name from you?
Doctor.
Go ahead, honey.
I myself, I tried for a week to get a hematologist, and they say it's not their problem. It's not their case.
All right, well then I'm going to get your phone number and I will get the right person to take care of you. Okay?
Okay.
All right, I promise you that.
Okay. Thank you.
Well,
Dona
I want to make sure I get your phone number.
Eu falei com o Dr. Carolino, foi você que me ajudou?
Sim.
Sou eu.
Foi ele. Doutor Carolina que ajudou a senhora. Ok. Qual é o número de telefone da senhora que o senhor quer?
Perfect.
Oh,
973.
já temos aqui o número da senhora.
Ok. Muito obrigada.
I can even give you his name. His name is Dr. David Grossman, and his phone number is 973
Ok.
322
973.
5200.
Ok. 973.
322 5200.
Thank you very much.
Another physician is a Dr. Michael Condi.
Michael Connie?
Condi, C-O-N-D-E, at the same phone number. These two physicians are well versed and will take good care of you.
Okay, okay, doctor.
That was easy.
Parabéns à senhora, porque este médico é uma joia. É um grande amigo que nós temos em medicina. A senhora pode considerar qualquer coisa que a gente precisa dele, esse médico está sempre pronto a ajudar.
Ok.
Ok, muito obrigada à senhora, boa noite. Acho que desliga, acho que a máquina não está muito certa. That's very nice of you, but we have to talk about that. If you plug me into it, I'll do it.
Absolutely. But people here have to know what's really available. And they
They
shouldn't be
have to know.
satisfied
That's it.
with care that is not the standard that they want.
Doctor, we need this as we need air to breathe.
I agree.
And I've been here for 30 years. Okay. Then I call all the doctors that I can to give me good doctors, and so so far so good. We've been. I know that we have great doctors. Doctors are like everybody else. Some have more patience. They pay more attention. They're more dedicated to help others. We're not all alike.
That's true.
Yeah, I know doctors. Doctors are people like us. Some they love to help. They love to do things, and you are a number one. You are a number one doctor who like to help people.
Well, I'm still going to say that most people are this way. Doctors are this way. So are nurses, physicians' assistants, all of us that
Some are, some are not. I work with you guys.
Okay.
Okay, that's like a woman who cooks very well, another one who doesn't like to cook. Period. Everybody does what they like to do the most. And you're born for a doctor. Look how many times I call you. Even when you're in surgery, you talk to me over the phone.
Well, it's tough to ignore you.
No, because I have a good purpose.
Absolutely.
It's because you care.
But there's also a reason. There are people here that are being underserved, and you're not going to stand for that.
I'm not. I don't care what they do, doctor. I am not standing for that. As a matter of fact, I have a couple of issues to discuss with you. Why? Because you are the type of doctor who listens. You are the type of doctor that cares. I send people to you, and they come out of there, and they think you are his cousin. They feel so good about it.
Well, my philosophy is I only want to treat people the way that I hope to be treated.
Absolutely.
And that's my responsibility.
That's a great philosophy. And
Simple.
You know what I tell people? My priority, it's the patient. It's my number one priority. My second priority is the doctor. Make sure that, ter a certeza que arranja médico que se interessa por aquela pessoa. Boa noite, faça favor. Boa noite, está no ar.
Olá, boa noite. Era para falar com a dona Isabel e com o doutor.
Estamos aqui os dois.
Mark.
Faça favor, estamos aqui os dois para ouvir. Diga.
O seu doutor Marco, o meu nome é Heitor Vinagre.
Artur Vinagre.
O meu nome é Heitor Vinagre.
Uhum.
Foi o seu doutor Marcos Gilder que me operou. E foi o seu doutor Gilder que me operou no dia 15 de julho do ano passado. E está tudo a correr a 100% e eu quero lhe agradecer imenso o trabalho dele que ele tem por mim. Parabéns e muito obrigado. Estou a ser visto com o...
Diga. Fale, faz favor. O senhor está a ser visto por quem?
Dr. Brown. Estou a ser visto com o Dr. Brown no Hospital São Barabás. Todos... O Dr. Brown.
Dr. Brown?
Dr. Brown is the medical oncologist.
Oh, yeah?
Mm-hmm. We took care of him a long time ago.
Yeah.
Está tudo a correr bem, é só...
Continue a falar.
How many years ago?
Há quanto tempo é que o senhor foi operado?
Fui operado no dia 15 de julho do ano passado.
July 15 last year.
Mm-hmm.
no dia 15 de julho do ano passado.
Sim, senhora, já traduzi para o seu doutor.
Está a fazer um ano.
15th of July of last
Right.
year.
I thought it was longer. Okay.
So, muito obrigada pela sua atenção. Thank you so much. E felicidades. Quero que o senhor saiba que está tudo bem.
I thought it was years ago. All right.
Yeah, last year. O tempo voa. Tudo bom para o senhor e boa noite. Nós de facto, I doctor when St. James close, I ask people to buy, when St. James close, I ask Barnabas to buy James. Because I'm sure they would come down and they would do a revolution. Okay, because I love St. Barnabas and I love my doctors. You guys are like my kids, and you know that. Okay? I mean a doctor. I care so much about my doctors because I respect them and I care about them because they treat us like they're treating their own family.
Well, how many years ago was St. James closed?
2006.
So for almost 16 years, this community hasn't had a direct healthcare center as part of it.
No. Then I asked them to buy a place here, like a lot of people do, and they did. Took them 14 years, but they did. And I'm the one who negotiated the building. They're there. Then when they open, I came on TV and I told my people, because you guys are my people, my family, it pus a cabo. E puseram lá um médico que foi meio em clínica que não mandava o meu gato lá. Então eu não mando ninguém para lá. Boa noite, faça favor. Boa noite.
Boa noite. Olha, Sra. Isabel, eu chamo-me Adelaide Carvalho. Eu gostaria de perguntar ao Sr. Doutor um nome bom, o nome de um endocrinology. O meu marido precisa de ir a um doutor desses.
Endocrinologist, this lady.
Yes.
Right.
Yeah.
Ele vai lhe dar.
Porque o Dr. Lander mandou-lhe ir a um em frente ao hospital, mas só daqui em dezembro é que tem um apontamento.
Em dezembro? Uau.
Se aí ele precisa de ir porque tem os glândulos do kidney e diz, that's why he needs to go in the gynecologist.
Qual foi o médico que mandaram a senhora ir?
Lander, Dr. Lander mandou-me ao marido ir, mas só em dezembro.
Only
É Dr. Lander for the heart. He works at São Barnabás Hospital.
Dr. Lander only in December?
Oh, Jeffrey Lander, yes.
Yeah.
Yes.
Jesse Lander told me to go in there, doctor, but I have the appointment just in December.
December.
And he needs to go to endocrinologist sooner.
Mm-hmm.
Do you think I should
If
talk
he
to this
has-
doctor?
Mm-hmm.
I should?
Yeah,
And tell him you told me to call him?
absolutely.
Ok. A senhora que me deu o seu nome.
Adelaide Carvalho.
Ok. E o número do telefone da senhora?
Ok, 908.
Ok. Não, já temos, minha senhora, já temos. Já. Ok.
Obrigada.
Eu vou dar o meu número de telefone à senhora.
Está bem.
201
201
207
207
22 60.
60.
Mas eu vou contactar
Ok.
a senhora. O seu doutor vai-me ajudar a contactá-la e a contacta a senhora.
E é ver se o senhor doutor sabe de algum doutor bom
Já.
para isso.
Yeah. Não.
Ok?
Ok.
Ok.
O número, qual é o nome do seu marido?
José Carvalho,
José Carvalho. Qual é a data do nascimento dele?
7/15/62.
Ok. Isso vai ficar gravado e eles vão me dar e eu depois chamo a senhora e digo o que é que está a passar.
Ok?
Ok? Muito obrigada à senhora. Boa noite.
Ok, boa noite.
We're going to take care of this.
That's not a problem.
No. I felt I couldn't think of anything because that doctor worked by me. One thing in this community, and everybody knows, you go to the doctor, they get out of the doctor, they tell me what happened. They go to the doctor, they get out of the doctor. I don't ask them, but they come. They tell me the good, they tell me the bad, they tell me what they like and what they don't like. If a long time I promised this community that I would get doctors to come to this place at least once a week. I don't know how you guys are going to arrange in Barnabas. So, ninguém vai lá porque não vão lá e as pessoas vão lá e vão dizer aquilo que eu sei. E a lot of these people came into my office and they said, Mrs. Castro, we promise you promised us that. What's the matter with you? I said, with me nothing. I says, they didn't consult me. Okay, they didn't talk to me. Next thing I knew, these people were there, what do you want me to do?
But we have a chance to make it better.
Oh, we have a chance to make it better because my problem is I don't have more doctors like you behind me. I'm all alone.
No, they exist. They're here.
I know.
They're here.
So and I still wanted to apologize to these people because these people still in my heart that I promised something and I couldn't deliver. But there's nothing I could do. Okay, I'm not a boss in Barnabas.
But I think you better say it in Portuguese.
Ainda me dói a alma de facto de não ter sido feito para os senhores, para vocês, aquilo que eu queria e que eu trabalho tanto para ser feito. Mas olha, Deus é grande, Deus é Pai de misericórdia. Este médico vai me ajudar e mais uns 2 ou 3 que me querem ajudar a ajudar vocês. Fiquem com Deus e um feliz Dia das Mães para vocês todos. E há que ter fé. Há que ter fé. Há que rezar a Santo Antônio para nos ajudar em Nossa Senhora de Fátima. Boa noite, muito obrigada. Esse programa é uma maravilha, esse programa ajuda toda a gente e nós temos médicos lá que são anjos da guarda. Anjos da guarda. Vocês nem sabem os médicos bons que nós temos naquele hospital. Mas quando não ficaram com St. James, eu fiquei com pena, doctor, because a lot of people leave the daughters work, they live with the children. So the ladies would go walk from home, go to St. Barnabas and see the doctors there. Mm-hmm. It was a big help for this community. Besides, the language. I was at a party at church Sunday, and tremendous amount of people who work with me came to me, and they say, Isabel, you've done a wonderful job. I says, I didn't do a wonderful job. I would have done a wonderful job if they had came down to these people.
Well, there's still a chance we can.
We always can, doctors. Mm-hmm. Nothing cannot be done. I'm the type of woman that nothing is impossible to do unless if you're dead.
Well, it could also be the responsibility of the council person when they come on and they're being elected here and to recognize the population and to come to the community and say, okay, we need to be taken care of. And at the same time, there's no reason why we can't see all of the physicians, nurses, PAs that are available through healthcare systems. And although there isn't a hospital that's present here in the community now, that could change for the future.
Absolutely, doctor.
There's no reason why a satellite can't be built here to take care of the people.
I agree with you. And we have people from all over, doctor. We have people from Newark, Harrison, Kearney, Elizabeth, Union, down the shore. People come from Florida because of this, mm-hmm. This program. People come all over, doctor. It's things that I need help to move. Okay? It's nothing, I cannot do everything. I think I do as much as I can. I work about 24 hours. Did you read that article? People know. If they call me at 10 o'clock at night, I'm there. If they call me Sunday, I'm there. My grandson was getting baptized and I left his baptism to be with somebody who needed it because that's my mission. This is my mission. Another thing that's particularly special for me, that's a pedaço de vocês, o médico que eu queria para mim. Did you remember when I didn't know you well and I always greeted you? Did you remember, doctor? Sometimes you ever said, what does this woman wanted from me? I heard things about you that they don't hear anymore from the finest friends of mine. And I said, one of these days I'm going to fish this guy and this guy is going to come with me to that.
Well, I'm here. I haven't left.
Remember, doctor, you probably said, what is this woman wanted from me?
No, I knew what you were all about.
Each time I saw you, I used to say, Dr. Gelder has everything. Remember? Mm-hmm. And you were always a gentleman.
Well, I've been on staff at part of now, it's called Cooperman Barnabas Medical Center now for 29 years.
Wow.
So I have seen things change. There is a new group of hospital administrators that are taking part of our system, and I will mention what I can to them and explain how I feel about people here.
Thank you.
And how I think that it's a responsibility that has to go both ways.
This is your second family, and you seeing a doctor. Others people are so grateful to you. Because a lot of people, they're grateful, but you know, I deal with the people. I have dinner with the people that they have been your patients, and I'm so proud of you.
Well, we're going to keep going.
We have to keep going, we cannot stop.
Can't
Se os
stop.
telespectadores, ninguém nos está chamando e eu tenho que falar inglês com o doutor e gosto muito de vocês e quero falar português, ajudem-me. Vocês chamem e digam-se o doutor e falem com o doutor. É muito difícil apanhá-lo. É lá como aqueles pargos grandes do festa you need somebody to help you push.
Right, right.
Por favor, chamem-nos, por favor, chamem-nos. E muito obrigada àqueles que chamaram e que reconhecem o que esse médico pode fazer para a nossa comunidade. Para todos nós. Sobre. Nós estamos. Por favor, diga, faz favor, estamos aqui à vossa espera.
É uma pergunta para o seu doutor, Dr. Gilder, não é o nome?
Dr. Gilder, isso mesmo. Faça favor.
Porque a razão que eu estou a perguntar é que o meu doutor de família, clínica geral, não é? Doutor de família, deu-me o nome do Dr. Gilder, mas não sei se é este, que é para a minha esposa que tem bleeding hemorrhoids.
Oh, yeah.
Okay.
E dá o trabalho que ele faz?
Oh, yeah. Tudo tem a ver com o Colin. Esse doctor, who's your doctor? Quem é o médico da sua esposa?
É o Dr. Benny Chu.
Benny
Okay.
Q?
Right, that's his internist.
Yeah.
Yes.
He referred this family to a Dr. Gilder. And he wants to know if that's this Dr.
That's
Gilder.
me.
Yeah, okay, well, it's a pleasure. I'm very happy to, that is you. I mean,
But I haven't taken care of you yet.
not yet, but
Okay.
I will make an appointment with
Okay.
you. But I was so happy to see you personally on TV. and I guess your phone number is 973-322-0250?
Yes, that's
Is
true.
that correct? Okay. How long of a wait for an appointment, do you think?
I think that if you call, we'll probably be able to see you within a week to 2 weeks. Absolutely.
Oh, very good. Very good. Thanks very much.
E se tiver algum problema, chame. Mas as empregadas dele são as maiores joias que eu já vi. De Jules.
Well, you can also say that you saw me on TV and I'm authorizing your appointment sooner.
Oh, very, very good. Thank you very much, Doctor.
All right.
Appreciate it.
Okay.
Ok, thank you.
Have a good day.
You too,
Okay.
you too, my
Bye-bye.
dear.
Bye-bye. Bye-bye.
A nossa janta é tão boa. Muito simples, muito boa. Coincidência, já viste, doutor?
You have to be funny about it sometimes.
Yeah. Se os telespectadores eu não quero ver essa hora se ir embora sem falarem mais com o doutor. Porque ele é um homem que trabalha muito, mas é muito bom para a nossa gente. Já viram esta senhora que tinha esse apontamento para dezembro? In December, this lady, the ones we're going to work at? Yeah. Os médicos estão muito ocupados. Os bons médicos para chegar a eles é muito difícil. Yeah. Muito difícil. I've never had problems with my doctors. No. And Dr. Gilder is a joy. Somebody needed an appointment. Alguém precisava de um apontamento. E ele ia para a Flórida para o casamento da filha. E no fim de 3 dias ele já estava em New Jersey para onde aquela pessoa. Somebody needed you. And you were on your way to Florida to your daughter's wedding. And 3 days later you're back in New Jersey to help the people. E isso diz muito do médico que o faz. E eu sei que ele trabalha muito, que ele está muito doente. Mas as enfermeiras do consultório, you're nurses are special. As enfermeiras do consultório deles são de facto uns anjos. Vamos lá continuar isso, então, os espectadores, que eu não sei quanto tempo é que falta. Depois o resto, Faltam 5 minutos. We have 5
That's
minutes
it.
left. That's it.
That's it.
See? So,
I guess we've solved everything.
no, but one by one we get there, Doc.
Okay.
Because we're persistent and we don't have anything stop us from doing anything. We think a lot the same. It's to be done, gets done. No matter what.
My only message here to the community is the same that I want to just put out to everybody, is that I do think the community needs better representation, and I think that it is available to this community. It exists. My organization, Robert Wood Johnson Barnabas Health, is available. Good. We are there for you. There are plenty of very good physicians like myself. There are excellent specialists, primary care physicians, nurses, physician's assistants that is available to this community. We can serve everyone here, everyone from cancer to transplant, for hypertension, for obesity, high blood pressure. We're all here for people in this community. And there are enough of us that can take good care of these people here. And they should never feel that they are not wanted. And at the same time, we're here to help.
And the proof is this, doctor, since I started this, then we have a problem here. Nós temos problema. Os doentes do Ironbound não podem ir em ambulância daqui para Barnabas. O que é uma coisa ridícula.
It is.
Absolutely ridícula. Uma outra coisa, doutor, ele vê muita gente durante a noite, mas chegou a um ponto que eu tive medo. Se eu tinha um acidente, ok? In my own car. As pessoas agora, há muita coisa que temos que conversar também para facilitar, ok? Porque essas pessoas, eu recordo-me, doutor, quando se falava, I remember when we used to talk about Barnabas, oh, this hospital is far away, it's up in the mountains. It's not in the mountains.
No, it's not in the mountains.
It's not in the mountains. But, you know, doctor, people who don't speak English, you know. Ok, boa noite, faça favor, se tu está aqui para ouvi-los.
Boa noite, Ana Isabel.
Boa noite.
Olha, eu apanhei o Covid, ok? Queria que me perguntasse aí ao doutor, porque quando eu apanhei o Covid, eu fiquei com uma tosse muito irritada. E tosse dia e noite sempre. O meu médico receitou-me um antibiótico, receitou-me um xarope. Durante uma semana eu andei bem, mas passada a semana eu continuei igual.
Okay, if it's a tutor. This lady had a COVID and she had a tremendous cough. You know, she was very sick. The doctor gave her antibiotic, gave her cough medicine. She was good for a week. After a week, she went back to this misery.
Right. This is something that a lot of people have experienced.
Muita gente tem tido isto.
And they talk about chronic cough as a result of COVID, and it lasts for months.
Yeah. Muita gente acontecido e dura durante meses.
E é porque eu já estou assim desde dezembro.
Since December.
I believe it.
Did she have anything she can do? Any specialist?
I think pulmonologists might be beneficial.
Ok. A senhora deve ir ver um médico que seja especialista dos pulmões.
E a dona Isabel pode me informar?
A senhora chame, one of them, a senhora chame que eu vou apanhar do Dr. Gelder e a senhora tem o meu número de telefone, não tem?
Eu acho que sim, que tenho.
201.
Um momento.
Agora não estou ouvindo a senhora.
201.
207. 207.
Sim.
2260. E a senhora conhece-me, sabe quem é isso? Não sabe?
Eu conheço, a senhora já me tem feito exames para ver no hospital de Tabarnabá.
Ok. Muito obrigada à senhora.
Muito obrigada por tudo.
Pelos contactos. Obrigada. Ok, não fez ainda, dá-me um minuto.
Ok.
Boa noite, minha senhora, muito obrigada. Eu quero lembrar a todos os telespectadores que este domingo é o Domingo das Mães. E lembrem-se que os nossos pais tiveram, muitos deles, muitas dificuldades para nos trazerem até aqui e fazer de nós aquilo que nós somos.
E é verdade.
Portanto, Mesmo aqueles que já não visitam os pais há muito tempo, vão-lhes dar um beijinho e agradecer o que eles têm feito por vocês. São as Mother's Day. And igualmente. I'm reminding everybody
Absolutely.
that's the day to go see Mom
Yes.
and Daddy. This should be woman and man, because the one and the other, é como uma galinha, it's like a chicken who doesn't lay eggs because doesn't have the rooster. Boa noite, muito obrigada a todos, beijinhos a todos, um bom dia das mães, e muito obrigada pelos seus maravilhosos conselhos.
Bonne nuit.